internal organs. This is part of the CoverScan study, which is researching the impact of Covid-19 on people who tested positive for the virus. Some became unwell, others had no symptoms at all. So far, more than 160 people have been scanned, and the preliminary results are shocking. 50% of patients have evidence of damage to their organs. In 39%, the damage was to their hearts, and for 14%, the virus had impacted more than one organ. The average age of the patients was 43, and nearly 80% of them had never needed hospital treatment. We first filmed here in June, not long after the study had begun, and spoke to one of the volunteers who tested positive for coronavirus but had had no symptoms. He'd come along because he wanted to further research into the virus.
How's my blood pressure looking?
So it's been a surprise for Sam Johal to learn the virus has affected his heart.
It's pumping less blood, less forcibly than it used to be, but only by a small amount. But I don't feel it really. I'm hoping it's something I can reverse, something I can fix, just with more exercise, with just healthier living, hopefully. But day to day, I don't feel it at all, which is a surprise. So it's a surprise that these results came out like the way they did.
The scientists don't yet know if the virus is always the cause of the organ damage, but say the results have implications for other Covid-19 patients and long-term treatment plans.
I think it's good to be aware that not one person is necessarily the same, and we need to take all of that into consideration as we start using data within models to look ahead and predict how COVID-19 impacts people. And indeed, as we prepare in our healthcare planning, how we can support each of these people.
This next picture, what we want you to do is to take...
The study's continuing and volunteers are still being recruited. They'll all have a second scan after 6 months, so Sam Johal will find out then if his heart is still damaged. Nicola Hill, TRT World, Oxford.
Just going to come and bring you out now. Well done.